Good morning and welcome to the Megacast. It is straight up at the beginning of the show. The governor is standing by. We are going to immediately today go to the governor's press conference and catch it for you live here on the Megacast. Probably not even much time to say hello to all of you here on the program. We have the governor's microphone open and just waiting. She's already on camera. You can see her if you are watching the Megacast. Tyler, they have done a beautiful job improving the set for these press conferences, because they were a little rough at the beginning. So big announcement. This is all supposed to be about the coronavirus today. And I don't know, maybe we're going to hear more about plans for the rest of the state opening on the 28th.
Good morning. Today is Thursday, May 21st. I am joined by a number of people today, but Dr. J is not by my side as usual. She had another commitment that she had to attend to, but I am still accompanied by a medical professional, Dr. Bobby McCumua from the Michigan State Medical Society, Doug North, who's not a doctor, but he's the president of North Brothers Ford, Ralph Shaheen, the president of Shaheen Chevrolet and Shaheen Cadillac, and Patty Roberts, the owner of Once Upon a Child. I'll begin today's remarks by giving you an update on the emergency situation in Midland County. Over the past 48 hours, I've been working closely with Midland County elected officials, the local Emergency Operations Center, the Michigan National Guard, the Michigan State Police, the DNR and Eagle departments, and the federal government to ensure that Midland County families who've been impacted by the flooding have the support that they need. I want to start by thanking our first responders who did heroic work in the late hours in the midst of a global pandemic to get people out and to keep them safe. 10,000 people were evacuated, and it is truly a testament to the people of the area, but also the first responders. I want to thank people on the ground who have been helping one another. When I toured the shelter yesterday, it was incredible to see the spirit of the community and the volunteering and the attitude that they're all in this together. We truly are, and thank you for inspiring me in these challenging days. And I want to thank our urban search and rescue teams. They've been working incredibly hard to make sure that we are keeping people out of harm's way. Last night, I sent a letter to President Trump requesting a federal emergency declaration to ensure that we have the support we need to protect Midland area residents. I'm hopeful that as he is coming to our state today, I think it would be great if he signed that emergency declaration while he's here in Michigan today, and that is my fervent hope. I've traveled to see the impacted areas yesterday and to survey the damage, and I can tell you I've used this phrase many times over the last 10 weeks, but this is unlike anything we've seen before. The damage is truly devastating to see how high the water levels are, to see roofs barely visible in parts of Midland, and to see a lake that's been drained in another part. It's truly remarkable how much damage we have sustained. But I think the most remarkable thing that I saw yesterday was people that were stepping up to help one another and take care of one another. If you know someone who lives in the impacted area, please reach out. Please make sure they're safe. Someone shared a story with me yesterday that there was a family that had recently moved into the area and didn't know people around. Their home was in the flood zone. And another person said, I have a place that I'm not using up north. Maybe they could use that. It's generous.
All right, it looks like we have lost the connection,
So,
and it has
if
come
you
back.
know someone who has
So,
been
sorry
impacted,
about
please
that,
reach
folks.
out. We're all Michiganders, and it's more important than ever that we remember that first and foremost, and that we take care of one another. Because this is truly a crisis in the middle of a crisis. If you are one of the residents in the impacted area, especially if you're at a shelter, please take precautions to protect yourself and continue to wear masks. Stay 6 feet apart, wash your hands. We don't want the spread of COVID-19 to grow, especially in a region where we've had to move people around so much. So ask that you continue to take care of yourselves and seek the help that you need. There's a lot available. Yesterday, DTMB released Michigan's April unemployment numbers, and to say they're high is an understatement. This virus has devastated families across our state and put a lot of hardworking Michiganders out of work. I will continue to work around the clock to ensure that everyone who qualifies for unemployment benefits receives them. But this isn't just a problem here in Michigan. Families across our country need help. We're counting on the federal government to work together to provide additional flexibility for states like Michigan and states all across the country to continue being able to support essential services like healthcare and education and police and fire, public safety, so we can all get through this together. On Monday, I announced that the UP and the Traverse City regions may open retail businesses, restaurants with limited capacity and strict observation of best practices, and office work that can't be done remotely. These regions stand apart from the rest of the state in terms of COVID-19 health indicators. They show the lowest cases per capita by a wide margin. They have extremely low deaths per capita, low and declining cases of COVID-19, low and declining need for hospital caseloads, and deaths per day of four or fewer. As I make future determinations about other regions in the state, these are the types of data points that my team and I are looking at. And as Dr. J said the other day, context as well. There are a lot of different assessments that go into determining the level of risk and how safely we can continue to move forward. Today, I signed a number of executive orders that will phase in additional sectors of our economy. The data has shown that all regions of Michigan are ready for us to take this small step forward. We're doing this incrementally, as I've said on multiple occasions. This is like a dial we're turning, not a flip, not a switch that we just flip. Today's actions include a repeal of the rule requiring non-essential medical and dental services to be temporarily delayed. We are repealing that. The statewide reopening of auto showrooms will be permitted by appointment only. Allowing retail statewide, but on an appointment-only basis, provided that the store is limited to 10 customers at any one time. The congregation of people inside is what's so dangerous, and that's why appointment only gives us the ability to start to re-engage this sector of our economy. And also, all of you pet owners, the return of veterinarian services. If your dogs are shaggy like my little boy Kevin, I know that that's welcome news to some of you. The orders also allow gatherings of 10 people or less, as long as people continue to practice social distancing. Wear your mask. These new provisions are effective immediately. As with previous announcements, businesses that reopen must adhere to safe, strict measures to protect employees, customers, clients, and patients. So this is another positive step forward in the re-engagement. We've taken significant steps forward to re-engage our economy safely and responsibly over the past few weeks. Now we're going to need to take some time to ensure that these new measures are working. We know that COVID-19 takes about 2 weeks to really see the impact of changes in our behavior. And that's why we're counting on everyone to keep doing your part. We want to continue turning this dial, but we are going to stay tethered to the data and the epidemiology to know when it is safe to do that. So please, as you are re-engaging in some of these activities, be smart. Continue to do your part. We can't drop our guard and run the risk of a second wave. So this also means we will have another short-term temporary extension of the Safer at Home order will likely be necessary, and you'll hear more about that in the coming days. What we are announcing today is good news, and the most important thing right now is to listen to the experts and follow the medical science. This will not look like business as usual, though it will start to look a little more normal. Employees will have to wear personal protection equipment and maintain social distancing to the best of their abilities. We all know Memorial Day is approaching fast, and I want to remind everyone to be safe. You can take the boat out. You can have a beer and grill some burgers, or have a water balloon fight with your children. But please remember to stay safe. This virus is still present in Michigan. So when you're celebrating, do it wisely. I'll have more to say in the coming days about what Michiganders can do to celebrate Memorial Day weekend safely. All of us know the importance of getting back to work and getting the economy moving again. We've already loosened some restrictions on construction, manufacturing, and lawn care. What we don't want to do is simply drop all of our guard. What we don't want to do is to just simply re-engage as though nothing's changed. Life has changed, and it's important that we change along with it so we can safely get back to some normalcy. The real heroes of this crisis are our medical workers, our first responders, the sanitation workers, our daycare providers, our energy workers, those who are keeping our utilities on and running, our grocery store workers. There's no shortage of people that are continuing to step up. Later today, I'll go over to a school locally and help distribute food. Our educators are working nonstop. We owe it to all of them to do our part to keep them safe and to keep our families safe. So, mask up, Michigan. Keep your guard up. I hope that you have a safe holiday weekend. And with that, I just ask that you remember to be smart and remember that you're safer at home. With that, I'd like to ask Dr. McCumwa to come and join me and speak with you next. Thank you.
Governor, thank you for having me here today, and thank you for your service to Michigan during these unprecedented times. I greatly appreciate the opportunity to be here on behalf of Michigan's physician community because, to put it plainly, we would like to get back to taking care of our patients and catching up on a lot of work that has been put on hold. For many, the response to the COVID-19 pandemic has brought life as we know it to a standstill. And Michigan's healthcare community has been in a unique position during this time. Many of my colleagues throughout the state have been on the front lines of treating patients with COVID-19. For them, the hours have been long and exhausting, with great risk to their own health and safety. Yet they rose to meet these needs of very sick patients. Many of my other physician colleagues, however, like much of our state, have been staying at home, trying to take care of their patients with telemedicine, using technology like FaceTime, Zoom, and the good old-fashioned telephone. Talking to patients on a screen, doing their best to make accurate diagnoses without the benefit of a physical exam, postponing procedures, and worrying about their patients as well as the future of their practices. Physicians, nurses, dentists, and others throughout our healthcare system have answered the call in helping the sickest of the sick. Now, with this announcement that allows us to resume taking care of our patients in ways that are much more effective at healing them, we are ready to get Michigan healthy and well again. The physician-patient relationship is a crucial one. It is built on openness, trust, and care. And right now, many people are rightly worried about COVID-19 and how it may affect them. They are also worried about their safety in getting routine care. To those in Michigan needing medical care, my message is clear. Call your doctor. We are ready to see you. And with the governor's announcement today, we are able to safely welcome you to our offices to answer your questions and provide the care that you need. COVID-19 will be with us for a while. We and all businesses must remain vigilant and follow the guidelines outlined by the governor and our public health officials. By following these guidelines, we can get back to taking care of our patients and get Michigan back to work in a way that is safe. Governor, physicians and nurses have stood with you and Michigan residents fighting COVID-19. We remain at your side as we enter this next phase, this very important phase of patient care. Thank you.
Thank you, Governor Whitmer, for your leadership during this crisis, and thank you for advancing the process of getting Michigan back to work. We are really excited to open up our showrooms for appointments next Tuesday and start selling more vehicles again. It sure feels good to share that news. People in Detroit and throughout Michigan love their cars and trucks, and we are here for them whenever their vehicle needs service or replacement. Car manufacturing and car sales drive our state economy, and Michigan automobile dealers are honored to be involved in the early stages of moving our economy forward. In difficult times, normal activities of life are often viewed in a new light. Things we used to do every day and take for granted become really exciting, like dining at your favorite restaurant or dropping by your local hardware store. Or for many of us, opening up our doors to customers again takes on a whole new meaning. Speaking as an owner of a Ford dealership in Westland for the past 33 years, this experience makes me appreciate all we have built together with our employees and our customers a great deal more. As we move forward and reopen our showrooms for sales appointments, we fully understand the responsibility we have to the health and safety of our employees and our customers. We will go above and beyond all recommended safety protocols. We also understand how we operate and behave will impact all residents of Michigan, as well as influence other businesses seeking to reopen in the near future. Lastly, we look forward to updating you all soon on our plan for the Great Detroit Auto Show in June of 2021. Believe me, our dealers and the residents of Michigan will all be ready. Thank you very much.
Thank you, Governor Whitmer, for allowing me to participate in today's state update. I appreciate your leadership during these challenging times and the work you've done to protect Michigan residents throughout the state. We look forward to continuing to work toward a safe reopening of our state. The transportation and automotive industry have been closely tied to Michigan's economy for more than 100 years. Even in times of crisis, the automotive industry has played a crucial role in keeping our state mobilized. We thank you for acknowledging Michigan's transportation sector as essential for Michigan residents at this crucial time. Since the pandemic began, workers in the dealership's parts, service, and repair facilities have been designated as part of the essential workforce. We've been able to provide products and transportation for healthcare and emergency workers. We've also been able to provide transportation for the residents of the state who need food and medicine and other necessities. I'd like to take a moment to recognize the dealership frontline workers, the service writers, the technicians, the facilities maintenance personnel, the team members who have implemented new cleaning procedures for vehicles in repair and service, loaner vehicles for customers, and the staff who have guided customers through these new processes. You have stepped up, adapted to some unique circumstances requiring heightened awareness, and made these procedures work safely. Your dedication has been part of the process that has enabled us to move to the next step. We look forward to offering the same level of services to customers who are invited to come back in person to our showrooms. We have the processes in place, we have the inventory to offer, and we're excited to reopen our showrooms for you. Again, thank you, Governor Whitmer, for your leadership and this opportunity. You and your team have put us in a position where we can now feel comfortable and safely and carefully get back to work.
Just want to let you know you are listening to a press conference. Governor Whitmer in Lansing and others from the automotive and other industries. We will recap the governor's announcements from earlier today, but she is opening more Michigan's economy and talking about the terrible crisis up in Midland, Michigan, and talked also earlier today about the 22% positive, not 22% positive, but 22% plus unemployment rate here in the state of Michigan. So we'll recap all this in a couple of minutes. Always interesting to hear the question and answer period from the media, so we're waiting for that coming up in a couple of minutes, and then we're going to check in with our friend Dave Lorenz at Travel Michigan. So we're going to go back to the press conference in Lansing.
Masks, social distancing, and occupancy limits. We are proud to be part of Governor Whitmer's steps to re-engaging Michigan. Thank you.
Thank you. I appreciate all of you being here, and I appreciate your taking every effort to keep your employees safe and your customers safe. I know that that's paramount for all of us, so we are excited. And for those of you who question how excited I am about moving forward, I got to correct myself already. I said that all of these things take effect immediately. I want to make sure that I'm clear and that I correct that statement. 10 or less, gatherings of 10 or less does take effect immediately. The auto showrooms by appointment and retail by appointment begins May 26th. And medical and dental and veterinary services begin May 29th. So I just wanted to clear that up because it's important that I recognize when I've made a misstep, and I share that with you, but also so that our employers, our businesses can take the time they need in order to ensure that their places of business are going to be safe for their customers and their employees alike. We all want to get this right, and we are excited about taking this next step, and that's the timeline. So with that, let's open it up for some questions.
Governor, you mentioned some form of extension of the existing stay-at-home order would likely be necessary. Does that mean it could still be a while before bars and restaurants outside of northern Michigan, nail and hair salons, gyms, and other businesses that were not included in your list today could reopen?
Things that were not included in the list today are not included in the list today. What we know is that coronavirus takes about 2 weeks incubation period of time. So between when you take an action and know what the result of that action is, generally it's a 2-week time frame. We have taken a lot of steps in the last few weeks. The re-engagement of construction, manufacturing, the re-engagement of retail by appointment, the re-engagement of medical. You know, we're taking a lot of steps. We've got to take a pause and see what it means in terms of what happens with COVID-19 numbers and the potential spread of COVID-19. What we know is that this virus is still very present in the vast majority of our state. And so we are asking people to be really smart as we take these steps so we don't have to take a step backwards. We can keep moving forward, but to know when the next step forward is, we're going to continue to watch the data, monitor hospitalization rate, monitor our testing capacity and positive tests that are coming in, and stay very close to our local public health departments so that we've got a real handle on what COVID-19 looks like as we determine next steps.
Governor, a follow-up on Lauren's question. What was the thinking behind allowing medical and dental services, some retail, but not including bars and restaurants in that group?
Yeah, so as we assessed risk inherent with different sectors of our economy, and you saw the six-stop phase-in plan, you know that there are certain activities that are riskier. Now, when you talk about the health care of people, whether it's optometry appointments or it is dentistry appointments, or how about what are a couple other examples, Dr. McCullough?
Kids that are stopping breathing because they got big tonsils. I see
Yeah,
it all the day long.
kids with big tonsils, right? So not an immediate emergency, but something that's important and that can impact your health if you go too long without getting it addressed. We've built up our stores of PPE. We've got health professionals who are trained in these types of best practices. And we know that putting these things off too long comes with an additional health consequence. And that's why we wanted to recognize that this is a move that we can safely make now. Now, we are working very closely with the MSMS and our doctors. We're working with the Dental Association. We want to make sure that we get this right. But with the additional PPE and the time to implement strategies in our offices, our healthcare offices, we believe that this is a safe step to take and a necessary step because we don't want people putting off some of these more routine in a regular atmosphere events that need to be seen.
Governor, you spoke with President Trump yesterday about the flooding situation in the Midland area. Can you elaborate a little bit on what you discussed, whether anything else came up? And could you say whether you would accompany the president if he does decide to tour the scene in Midland?
Yes, so we had reached out to the White House yesterday morning. We had tried to get a call scheduled, and it came in late yesterday afternoon. It was a brief call, but we did talk about what was happening in Midland. He asked a few questions about if there had been casualties, asked about the extent of the damage. I confirmed that FEMA had been on hand. The regional partner in FEMA, James Joseph, has been someone who we've gotten to know very well over the last 10 weeks, and so they've been really helpful. And he said he will, the federal government will do whatever they can to help us. So I sent the letter last night. It's my hope that when he comes to Michigan today, he'll sign it. I think that would be a great thing. And he did say, if I get an opportunity to go to Midland, would you consider joining me? And I said, of course I would.
Are you aware of any kind of tentative schedule for that Midland trip?
I'm not.
What kind? Since we're talking about Midland, what we know that schools have been that shelters have been created. What other unique steps are you creating to deal with the simultaneous flood crisis and health crisis?
Well, I appreciate the question because I want to take a moment to just really acknowledge the incredible leadership at the local level. You know, across our state, we've got local emergency operation centers. And I've been so impressed by the kind of work that they've done, the way that the community has responded. It really was something to behold. And if it wasn't in the midst of COVID-19, I would invite everyone to come into Midland and talk to people. I mean, it's really remarkable, the community spirit and the way that people have reached out to help one another. It was very moving. And it was interesting today, I got a note from someone in Midland that was just generally supportive, and I just really was very moved by it. So what we know is that, of course, COVID-19 is still very present, and that's why the evacuation of 10,000 people and, you know, in the evening hours was something that was really important, that they had a plan to do it and to do it well. They've been running all of their exercises. Of course, no one anticipated we'd be in the midst of a global pandemic if and when something like this happened, but they rose to the occasion, and I think that they've done it well. Going forward, I mean, decisions are going to be driven by the local leadership. That's how we best operate in these emergency operations that are, you know, Mother Nature initiated and confined to one region of our state, and that's how we'll continue to operate in this regard.
Governor, the Infrastructure Commission, former Governor Rick Snyder created in 2016, called for spending $225 million over 20 years to shore up and start removing some of these troubled dams in Michigan. With the current situation, is it time to revisit that recommendation and start to put money into this issue?
Well, Lauren, I've been running, I ran on, and I've been introducing solution after solution to try to fix infrastructure in Michigan. I ran on fixing the dam roads, but we all know that it wasn't just roads, it was dams and roads. The fact of the matter is, we have underinvested over the period of decades in this state. And when you have 500-year events happening, 100-year events happening with more frequency, we know that this underinvestment is going to come with a very big cost if we don't take this seriously. I know that the 45-cent gas tax was not embraced with a lot of enthusiasm, but the fact of the matter is, we know that we've got hundreds of dams, we've got thousands of bridges. By the way, a few bridges were wiped out when the dam failed. We've got roads that are filled with potholes, and this is what I've been trying to fix. I would love to have some cooperation and partnership from the legislature and the federal government, frankly, to reinvest in infrastructure. But we need to be very clear. This is a privately owned dam. We can talk about the merits of whether or not private companies should own critical infrastructure. I don't think that they should, but that's what we're dealing with here. And we need to make sure that we've got the help that we can rebuild these critical pieces of our infrastructure. Ask anyone who lives on Wixom Lake what they're looking out at now. It is drained. Their life is changed. Obviously, we're first and foremost focused on the people who had to deal with floods coming into their homes. But we all pay when infrastructure fails. And that's why we've all got to be a part of making sure that that doesn't happen.
Governor, I'm going to play a reporter's trick and cram two questions into one.
Okay, well, thanks for being so obvious about it. Announcing it. Thank you, Rick.
Well, it's pretty obvious. Just So you're facing a budget deficit. How has the twin crises, COVID and the Midland dams, affected your plans to deal with that deficit? And what conversations have you had with the Republican leadership in the legislature about the budget and those plans?
Well, one of the conversations I had with the Republican legislative leaders on Tuesday, with the whole quadrant on the phone, was that if and when either of the leaders in the legislature is going to be spending time with the president while he's here in town to reaffirm the need for that fourth supplemental. It's really important. I know that Senator Shirkey has made some comments that he believes that we should not make any cuts to the school aid fund in the current fiscal year. I agree. I'm hopeful that he will avail himself of the opportunity to impress upon the president how critical this fourth supplemental is. And Speaker Chatfield indicated that he would do that as well, and I'm hopeful that they do. I've got an ongoing conversation with Fred Upton. Obviously, he's not in the United States Senate where the next vote takes place, but he is part of some of the conversations. I think that that's important. I've been talking regularly with Senator Stabenow and Peters, as well as the rest of our congressional delegation, Debbie Dingell, and maybe I should name everyone because I don't want anyone to be unhappy, but the fact of the matter is I'm talking to the whole delegation. Each of them understands the precarious position we're in. And let's be clear, but for the flood, Michigan's not alone in what we're confronting. This is a problem in every state in the nation, and that's why you've got governors on both sides of the aisle calling on the White House and calling on the U.S. Senate to get this fourth supplemental done. We need additional resources and we need flexibility. And if that wasn't acute prior to the last 72 hours, I think it's even more front and center for us now.
Last question, Governor, the dam in question had been deemed unsafe by regulatory bodies for 13 years. Can you talk a little bit about why the state DEQ and then Eagle didn't act immediately to make the Edenville Dam safe once it came under the state's regulatory authority?
So first and foremost, let me acknowledge a couple things. This is a privately owned dam. This is a dam that we are in the midst of, going through this investigation. We have to get the facts, and every one of us deserves to know what those facts are. Me and everyone who lives in Midland and everyone across our state deserves to know what the facts are, and that's why we've got a process for this investigation. We've got to let that play out. What I know is that where there is culpability, we will pursue getting, holding people accountable. And that's what I know. What we don't know are a lot of different pieces of what has gone into and contributed this. But I'll just say this, this is owner of a dam with whom we have had litigation as a state. And understanding all of the different moments that have contributed to this, I think is underway, and we'll have more to report on that in the coming days.
Thank you, Governor.
All right. Thank you, everybody.
Well, there you have it
Please
from
stay safe.
Lansing Governor of the state of Michigan, Governor Gretchen Whitmer. A big press conference today. We'll recap what happened as they wrap things up there in Lansing. Dave Scott, Tyler Keefe back here in our Lakes FM and Civic Center TV studios. Thank you very much for joining us across the Megacast. Didn't really have a chance to say hello with the press conference beginning right at 10 o'clock today. Dave Lorenz is standing by. He's a vice president of the Michigan Economic Development Corporation, Travel Michigan. Perfect day to have him on. So here's what the governor had to say today. Of course, she addressed the issues surrounding Midland. A lot of that came up in the Q&A that we heard right there at the end of the press conference, and clearly some concern from the governor over that privately owned dam. President and the governor talked yesterday. They may be going to visit the site, and the governor responded to reporters by saying if the president comes in, that she would join him on a trip to Midland. And there have been the communications back and forth, not an emergency declaration yet from the governor or from the president. But of course, the president is here in Michigan. Will be later earlier on today at the Ford plant in the Ypsi area, and the governor said, wouldn't it be nice if that emergency declaration was signed by the president while he is here? We'll get on to COVID issues in a minute, but she did talk also about the unemployment numbers for the state that came out yesterday, and Michigan's unemployment numbers, a terrible number, 22.7% unemployment in the state of Michigan. So it's been a rough couple of weeks for us here. Of course, the COVID-19, the floods up in Midland, 22% plus unemployment in the state of Michigan. With regard to COVID issues, of course, Northern Michigan reopening, and we're going to talk to Dave Lorenz about that in a couple of minutes, with bars, restaurants, and offices and other establishments opening with lots of rules and regulations, and asked why that's happening up there. And the governor shared the rates of the COVID-19 virus under 2% in Region 6, which is the tip of the Mitt area, and under 1% in the Upper Peninsula of positives for COVID-19. So safer place to start. That was always part of the plan. Big news today, new executive orders on the way, and dentist offices, doctors' offices that have not been open, your ophthalmologist, other doctors' services, but dentists in particular. I'm really glad to hear that, Tyler, because I need a teeth cleaning really bad. I can smile. You see, these choppers need a little bit of work. So we are excited to hear that. That's going to happen on May 29th. Auto showrooms, big news for Michigan. Those are going to reopen on May 26th with appointment and fewer than 10 customers at a time. Retail, big news, opening statewide. We've had curbside that's been working out pretty good. Now it extends to 10 customers in the retail establishments, and I think if I got the dates right, that's going to be May 26th. There was some confusion at the beginning of the press conference exactly when that was going to go into effect. And then here's the other big one that affects all of us. Stay-at-home order is still in effect. However, gatherings of 10 people or less are permitted immediately, and that will have some great effect. Governor did say, on the other hand, that to expect an extension of the stay-home, stay-safe order that is going to expire on the 28th of May. But the 10 people or less gathering really opens things up. Governor got a little bit lighthearted. She said, have some fun on Memorial Day. This is the direct quote. Get out and have a water balloon fight in the backyard. It's okay to go out and fish, get on your boat and have a beer, do it safely, social distancing, on and on. And that's the big story today. So we're going to be opening in northern Michigan beginning tonight at midnight, and more opening here. I think the big winners are all of us as we continue to see things open. Certainly, one of the areas of concern is for our restaurants downstate. Just so happens, later on in the show, we're going to talk to John McNamara, the Vice President of Government Affairs for the Michigan Restaurant and Lodging Association. Probably very happy with what's going on up north, a little bit concerned with what's going on down here. But Tyler, I don't think anybody expected that we were going to see restaurants open in the southern part of the state. It's been part of the plan all the way along, and I think people expect that that's going to be happening later. I was interested that we didn't hear about nail salons and hairdressers and those kind of things and barbershops, or did I miss that today?
I didn't hear anything about those specifically either. I don't think she did mention them today. It is interesting that those weren't mentioned, as they have been right there along with restaurants in terms of sectors of industry that have been closed and looking to reopen.
There was a lot of information today. She even got a little bit of it wrong. So let's double check, because we all know that I need a haircut. It's not all about me. You probably need a haircut as well. So we're going to take a break. We'll be back. It is Thursday here on the Megacast. Thank you for joining us on 89.3 Lakes FM, 88.1 WBFH The Biff, WAHS 89.5 Avondale Community Radio. In Birmingham, we are on Channel 15 Comcast and the surrounding communities. Same thing in West Bloomfield and surrounding communities, Channel 15 on Comcast, Channel 99 99 AT&T all across Metro Detroit. Our Facebook partner today, the West Bloomfield School District. You can watch us there. And, of course, you can watch the show each and every day on CivicCenterTV.com. Back in a moment with Dave Lorenz when the Megacast continues.
Hello, I'm Dr. Faust, Medical Director for the Oakland County Health Division. Coronavirus disease 2019, or COVID-19, is a new disease caused by a new respiratory virus named SARS-CoV-2. COVID-19 was first identified in December 2019. There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Avoid close contact with people who are sick, and avoid touching your eyes, your nose, your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Finally, stay home when you're sick. For more information about coronavirus disease 2019, go to oakgov.com/health or call 1-800-848-5533.
Hi, I'm Dr. Jonay Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
And good morning and welcome back to the Megacast. Dave, Scott, Tyler Keefe in our Lakes FM studios in West Bloomfield, broadcasting all around Oakland County. We thank you for joining us on our amazing community radio stations. 89.3 Lakes FM, 88.1 The Biff, Bloomfield Hills and Birmingham area. 89.5 Avondale Community Radio in Macomb and Oakland County. Thank you very much for tuning in there. And thanks for joining us on our television outlets, Civic Center TV, Birmingham Area TV, and of course you can also watch on CivicCenterTV.com. Good morning. Thank you. Wow, what a busy morning, Tyler Keefe. Governor press conference, a lot of interesting news in there, and well, these are crazy times, I'm telling you. Midland flood, coronavirus, president here today. And it's one of the busiest times I can remember, and an honor and a privilege to be doing this broadcast in the midst of all of this. And what perfect timing to have our next guest. He's Vice President, the Michigan Economic Development Corporation, Travel Michigan. We know this guy, Dave Lorenz. Hello, Dave. How are you?
I'm all right. Thank you, David. You know, aren't we all just looking forward to the possibility of one of these days not hearing the words historic event, at least for a little while?
Because, I would take 10 minutes of not.
Yeah.
It's been, oh my goodness. And I know your heart goes out to, as ours does, to the people of Midland. We know they're suffering right now. I was driving across the state on Monday, and I drove through that rain, and I had to drive north and back south. And you know, one of those days when the windshield wipers are going nonstop and you still can't see? It was like that all day Monday. And then to see the terrible result is awful for our friends in the middle part of the state.
Yeah, over here on the west side of the state, I'm in the Muskegon area, so flooding on this side of the state as well. You know, so it's been a statewide event. And something that I guess we're not totally surprised about. We've seen higher water levels in the Great Lakes coming our way for the last couple of years. I know when we met as a travel industry in February, when we had our Pure Michigan Governors Conference in Tourism in Grand Rapids, I wrapped up the conference with saying that while I was really pleased and see some great things in the future in a lot of ways, the three things I was most concerned about was a lack of funding for Pure Michigan, the high water levels, and the coronavirus. And man, if there's ever been a time when I didn't want to get 3 strikes in a row, that was it. Because unfortunately, I was, for the first time in my life, right.
Yeah,
They've
well,
all been causing us huge problems.
It's tough, and I was, I'm a pilot, and I was flying last week over the lakeshore from Holland to Grand Haven, and I had not seen what I saw, but real devastation on the lakeshore with erosion, and you could see from the air some of the homes that are in danger over there. So there's just so many issues. We almost got the great quote out of the governor today. She was that close to saying, damn dams. It almost came out. Fix the damn dams. But, it's just, there's so much going on. I don't mean to make light of things up there, but, oh, well. So, go ahead.
Those of us who are around in that, I don't remember if it was 1988 or whatever. I used to live on the Muskegon River in the Maple Island area. My family did. And I remember that high water level and all that flooding and just countless houses underwater. And it was devastating, very difficult for a lot of people. But there is one thing, we always need to keep in mind, because I think when we're in the middle of these really horrible crises, they seem like they're going to go forever. And we need to remember that we'll get through this, and they don't go forever. There'll be a day, probably within our lifetime, when we're going to be talking about low water levels. What goes up must come down. And unfortunately, the dam challenges, excuse that strange use of language, are going to continue to cause us problems, as all infrastructure issues have been causing us problems for years. And I'm really hoping that one of these days we as a society will take those things seriously and find a way to come together to fund the work that needs to be done. I mean, nobody wants to pay more taxes, but everybody expects more services and more appropriate services. I understand that too. So there's got to be a way to come to the middle on these things. Almost always, when you take two opposing sides of any opinion and you try to get to the middle, you find a way to get things done. And I'm really hoping that we can get all of our policymakers and all of our citizens to come together and find a way to get it done. And it kind of leads to our campaign that we've just announced, the Two Peninsulas, One Pure Michigan campaign, that you might be seeing some billboards or maybe some TV out there. We put it together as both a celebration of who we are and what we are, but also a call for unity. So as we deal with these challenges, I'm really hoping that people can try to get away from, the typical partisan way to look at these things and try to find ways to work with each other. We can do it. We can get these things done if we come together.
Well, Dave Lorenz, well said, and it's one of the reasons I always enjoy talking to you, because you are always upbeat, positive, and an inspiration, and we appreciate that. It's been fun connecting with you through the various media outlets. You've been doing an awful lot. You've been doing some great virtual social media activities yourself lately. We've been tuning in, but for the people watching right now that might not be aware, tell us what you've been up to.
Well, we've been trying to both inform the public and prepare the travel industry for travelers who are going to be out there pretty soon, and at the same time, start to prepare the travelers for what will be their summer and into fall travel experiences. Pretty soon we will be out there traveling. Now's not the time. We need to stay home, keep everybody else safe. But we need to all prepare ourselves. So we've been gathering up kind of best case scenarios from around the country. And soon you're going to hear some of our communities coming out with their plans on how they're going to make sure that their communities are safe for their residents and their visitors alike to come and enjoy as retail and restaurants and all this start to open up. But at the same time, it's going to be important for travelers to realize that this is a two-way street. We need to be responsible travelers as well. So we'll be trying to get that information out about, what that means, how we will travel, how we will keep each other safe in this very strange time. Meanwhile, we've also been trying to keep people's spirits up, and the Pure Michigan brand is a powerful brand, and I think most people see Pure Michigan as a reminder that we are one Pure Michigan. So among other things, we ran a fundraiser on mlive.com and on the Pure Michigan Facebook Live channels a couple of weeks ago, and brought in some money for all those displaced travel workers that are out of jobs. There are something like 300,000 plus people from the travel and tourism industry that are out of jobs right now. We want to get them back to work, but in the meantime, the unemployment benefits just aren't making it for them. So we put together in a relief effort with the Michigan Restaurant Lodging Association, and we had a really good time bringing musicians and celebrities and other guests talking. And you can still see those programs if you go to michigan.org and kind of go down the page and go to the Come Together page, and you'll see a variety of programs we put together, including we had interviews with Tim Allen and Mitch Albom and so many other people. So watch for that. And I know there are a lot of efforts to help out with right now, including the Midland issue. But if you'd like to help the relief effort for displaced hospitality workers, that website is mrlaef.org, as in Michigan Restaurant Lodging Association Education Fund.org. And we've been doing a variety of other things, but our goal is to bring us together, to encourage us to travel in Michigan when the time is right, and encourage people right now to do their research at michigan.org and to make their bookings. And Dave, this is really important. It's going to be crazy busy out there once we're allowed to travel. So make your bookings now. My wife and I are going up to Mackinac, to the island in mid to late June when they open up. Can't wait. And we're making plans for the rest of the summer and into the fall. I recommend you do that too, because it's going to be so busy you might miss out if you don't make a booking right now. And don't worry if the stay-at-home order is extended, you'll be allowed to move those reservations later. So to get to it, I'm telling you, you better do it now.
Dave Lorenz, thank you very much for the update. The charitable effort is well needed. I'll get a check off myself today, and we'll encourage people to go to that destination. We're going to talk to John McNamara in a couple of minutes here from the Michigan Restaurant and Lodging Association as well, so we'll have another opportunity to do that on the program. So Northern Michigan is going to begin to open up. This is a big evening. It happens at midnight tonight. Yeah. And Zone 6 and Zone 8, we saw the governor say a couple of minutes ago the numbers are low. 2% in Zone 6, the tip of the mitt, under 1% in the UP, so that's all good news. But tonight, and I'm going to be in, I got a place in Northern Michigan, so I'm heading up today, and so I'll be there to see what's happening, and we'll report on it. But, we got to do the right thing now. We have to do the right thing and enjoy, but do it responsibly, because what didn't open today were restaurants downstate. And if things go well up north, then I think it will make it easier for the governor to open up restaurants and lodging downstate as well.
Yeah, you're right. And we're going to rely on our Northern Michigan friends to figure out how to do it right, and we're trying to help them out. Hey, it's important to realize, though, that those opportunities for retail and restaurants and such up north are for the local residents. We should not be traveling from downstate up to these northern places. Unless, like you have a second home, then that's okay. But please don't consider this for general travel yet. We're almost there. And if we can just hang tough a little while longer, we'll get through this thing a lot faster if we all do our part.
Yeah, and the governor stressed that, and we've been stressing that as well. If you got a place and you've got to get up there and get it open and get things done, and then it makes sense. But the stay-at-home order is still in place here in the state of Michigan. Nice to see it opens up a little bit, though, today. Gatherings of 10 people or less. I think that's going to be really helpful for people as they begin to gather around the state of Michigan. And listen, it's going to be we're going to be out there. We're going to be out there before we know it. And I really like your advice about making reservations, getting the plan in place. You can, if it doesn't work out, right, you can adjust your plan. But I agree, Dave Lorenz. I think it's going to be, as things open up, which hopefully will be June, July, August, that it's going to be really busy at our venues.
It will be, and part of our responsibility will be to carry our face masks whenever you're inside a building, a public building, restaurants or whatever. Pay attention to all that social distancing. Even when you're outdoors, you're going to see communities opening up downtown streets, so there's more room. They're going to make a lot of adjustments for us. So we need to do our part to make sure that those local communities stay safe, that we stay safe, and that we're allowed to get back to some sense of normalcy. I know it's uncomfortable and nobody wants to wear those masks, but it's not forever. So let's do our part now.
No, and I know you've seen it, and I'll give you one more chance to say it again, but what we see here in Oakland County, and from the reports I'm seeing in the media, people are really doing a good job. They're wearing their masks. They're doing. I mean, when I go to the grocery store, and I don't go often, but when I go, everybody has a mask on. You get close to somebody and they start to back away a little bit. The retail establishments, and primarily the carryout restaurants that are open, it's amazing the contraptions they've come up with, and plexiglass here and carryout places there. And, the people have, and that's why our numbers are okay, and that's why the governor is opening things up today. Yet the people have done it, Dave Lorenz.
Yeah, it's absolutely true. Well, for the most part, there are always the conspiracy theorists who thinks everything's, some plot to harm others and specifically them. But the fact is, if you don't want to play by the rules for now, first off, they're not going to be those rules forever. So stay home. Just don't play. But leave it to other people to be able to travel and to be able to exist in a safe environment until we get through this thing. And I totally respect people's opinions on this thing. I really do. But that's the rule right now. So if we do our part, we'll get through this thing. The general guideline for right now is if you need a car, it's probably too far. So, trying to stay in your own area. I'm really happy to see some retails opening up to some degree, with the new rules. That's going to be the first start. So again, we don't want to go backwards. I was thinking the other day that I'm one of those guys that when I get something that needs to be put together, I never look at the instructions. When I'm all done, there's always that part left over, and I've got to do it all over again. Doing it all over again here means people might die. So let's not have to do it all over again. Let's just follow the rules, follow the instructions. Come on, we can do that. We're adults, and let's get through it.
All right. Well, I'm looking forward to my reporting this weekend, seeing what's happening. Again, it's all business. My trip to Northern Michigan, and I did.
Yeah. You might want to check out wineries and things. Just because undercover reporting needs a lot of serious work.
Well, actually, what I am curious about? I mean, because you talk about rule breaking, I am going to file a story on what happens at midnight tonight in Northern Michigan. I have to go there anyway for personal reasons, legitimate personal reasons. So while I'm there, I'm going to take a camera and we're going to see what we find out up there, and we might file a story. Dave, thank you so much. I appreciate you taking time for our little old show here in Oakland County. I know how busy you are, and my best wishes to you personally as well. We really appreciate you taking time and the amazing work you do for the state. You're just such a positive, upbeat spokesperson for everything Michigan, even beyond travel. So you're greatly appreciated and loved by many.
Well, thank you, David. Back to you. Thanks so much.
All right. Dave Lorenz from Travel Michigan Economic Development Corporation, joining us right here today on the Megacast. In that same vein, we are going to check in with John McNamara, Vice President of Government Affairs for the Michigan Restaurant and Lodging Association, right here at home, our own West Bloomfield School District, taking a leadership position here in the state, putting plans in place for the fall, and we'll talk to them and see what is going on at West Bloomfield Schools. They have already put together a plan, Tyler, for how they're going to make it all work. Students at home, students in school, split schedules, and the first school district in the state of Michigan to announce those plans. So we'll get an update on that. And I believe our own Erica Jones is out in the field this morning. And did she make it up to the Oakland County Farmers Market?
She is at the Oakland County Oakland County Farmers Market. Easier for you to say.
And hopefully she'll bring us back some lunch, too. This is 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills, WAHS Auburn Hills, and all of our other outlets. We're going to take a very quick time out, and we will be right back here in the Megacast.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Hello, welcome back to the Megacast. We are on great radio and television outlets all across Oakland County. We thank you for tuning in. 89.3 Lakes FM, 88.1 WBFH The Biff, WAHS 89.5 Avondale Community Radio. So happy to be there every day. Thanks for watching in Birmingham and West Bloomfield and Kegel Harbor and Sylvan Lake and other Franklin and Bingham Farms and Beverly Hills and Channel 15 Comcast, Channel 99 AT&T, everywhere else. A huge thank you to the Greater West Bloomfield Cable Communications Commission. They're paying the bills, Tyler, so we got to say thank you to them. We really appreciate all that they are doing to make this happen. Let's move on. We wanted to talk to Deanna Barash at the beginning of the show. Deanna, I'm sorry, the governor upstaged you there a little bit, so thank you for being patient with us. Deanna is the assistant superintendent for curriculum and instruction at the West Bloomfield School District. And if I can have you wait for 30 more seconds, we want to talk to you about the amazing work that you've been doing in West Bloomfield, a plan that was released Monday night that the whole state of Michigan is talking about to get students back in the classroom in a way that works during this challenging time. If you would be kind enough to give me just 1 minute, because it is a huge headline day, and I just want to quickly share the headlines with our audience, and I'll be right back to you. Midland, of course, making news. The president and the governor have both said that if they go to Midland, they'll do it together. That's good. Good to see the governor and the president working together. We'll keep an eye on what's happening in Midland. Clearly, a lot of problems up there with the water. They said the flood stage down to about 35 feet right there around Dow Chemical and throughout Midland. So good luck there. Tough news of the state of Michigan. Unemployment numbers came out for April, 22.7%. Northern Michigan begins to open up tonight at midnight. Governor said a lot more is going to open up for the rest of us over the coming days. Immediately, gatherings of 10 people or less are now allowed under a brand new order out from the governor just this last hour. Also getting ready to open dental offices, orthopedic offices, veterinary offices, automotive showrooms, retail establishments. Finally, you guys are going to be able to open up for 10 people or fewer and by appointment. And we got all the times and details on that. We'll share that with you later on in the show. But those are the big headlines. Just wanted to make sure you knew that. That happened moments ago. We have the entire governor's press conference recorded, and it will be on Civic Center TV later on today. And the president will be at that Ford Motor plant in the Ypsi area. I think, Tyler, around 1:30, 2 o'clock today?
It says he is scheduled to arrive about 1:40.
Let's see, this president, if he says 1:40, I would say maybe 3,
sure.
Probably somewhere around there. He never runs on time. Yeah. So, and I'm sure he's going to have something interesting to say. And all of Michigan is waiting to see if the president is going to wear a mask. That seems to be the biggest story out of this whole thing. So, all right, we'll keep an eye on it. And that's kind of cool to see that the governor and the president, they clearly don't like each other. But, in the case of getting the Midland thing done, they're going to work together. All right. So, with all that said, let's talk schools and education. Deanna Barash, Assistant Superintendent for Curriculum, West Bloomfield School District. Deanna, good to have you on Zoom. Thanks for joining us. So, big school board meeting Monday night, and you folks must have been working hard behind the scenes to put together a plan. You're the first district in the state of Michigan to announce. It's been reported everywhere. Would you tell us what your plans are like and just bring us up to speed?
Sure. So thank you for having us and letting us tell you a little bit about what we are planning. So I want to start with a clarification, Dave, just to make sure that your listening audience is aware. We obviously will follow whatever the guidelines are at that point in time when we return in August. So if there's an executive order or obviously direction from the Michigan Department of Education, we will do whatever it is that direction says. But what was important to us was that our families and our community and our staff knew that we had a plan when we left at the end of this school year, so that no matter what was going to happen in August, that we were prepared. And so, yes, my team, which is a great group of individuals who are forward thinkers and always looking to do what's best for kids, have been working really hard for really about the last 5 or 6 weeks to develop a series of plans that really will meet a variety of needs and concerns that we've heard from parents and from our staff members as well.
So this plan is the first one that any district has put out in the state of Michigan, and it isn't an easy pill to swallow. Let's be honest, none of this has been easy. And your plan talks about students being home part of the time and in the building part of the time, I assume to lower the number of people in the classrooms and allow for social distancing. Can you talk about that?
Sure. So the first plan is exactly that, Dave. It really is based on just yesterday, the CDC released their guidelines, revised guidelines about a return to school. And they are mandating right now 6 feet apart, students staying in the same room all day, no lunch in the cafeteria, all those sorts of things. And we really were planning from the very beginning. It is very difficult to socially distance students when you have 25 students in a classroom. It's virtually impossible simply because of the number of spaces that we have, the square footage of a classroom. And what we want to do is to reduce the amount of exposures that students might have during the course of the school day. And the only way that we really can do that, socially distance safely, make sure that students are moving as a group and don't have a lot of exposure, is if we have students learning at home part of the time and in person part of the time. And that's really where this plan started, was be able to get back into school in August for face-to-face instruction, but recognize probably at this point in time, 100% of students returning to school may not be an option.
Yeah, and it is going to be a challenge. Who knows where we're going to be? You don't. So you got to put together a plan. But, foreseeable. The governor already said that we are not going to have full football stadiums in the fall. So if we're not going to have full football stadiums, taking a couple thousand students and putting them in a large high school, be it West Bloomfield, Walled Lake, Avondale, wherever, these are big populations of people all in a very confined space in a building, probably going to be difficult. How's it going to work from an educational standpoint? As you started putting these plans together, what were your considerations about having students home half of the time?
We wanted to make sure that we have technology available for our students so that the learning still continues. We have asked our parents to do a tremendous amount of work in the last few months, being able to keep their students maintained online, Zooming with their teachers every day, which has become the norm for all of us, and making sure that they're moving forward instructionally, which is very, very important. So we recognize that when we bring them back into school for face-to-face instruction, we wanted to make sure that it is very valuable time, that there's a real intention to why they come every single day. And while they're at home, and when they're learning from home, that they have the technology access they need, whether that is a Chromebook, whether that's access to Wi-Fi, whatever those things might be, so that their education can continue. We also know that it's important to keep our buildings clean. And so the first part of our plan, which is 2 days of instruction, same group of students, Monday and Tuesday, and then Wednesday, a remote learning day for the entire district, is really based upon student safety and staff safety. We want to be able to get in and do a deep clean every single time our students leave the building, and so that when we bring in a new group of students, that they're not going to be exposed from the prior group. And so we're making sure that we are meeting the needs instructionally by technology, having teachers that are going to be monitoring that at-home learning so parents aren't expected to do it all by themselves. And certainly what's happening in the classroom needs to be very intentional so students can excel and continue to grow.
She is Deanna Barash, Assistant Superintendent for Curriculum and Instruction. How do you fit all that on a business card? That's an awful lot. West Bloomfield School District. Deanna, I thank you very much for being with us today. Good to have you here on the Megacast. And, it was maybe a little bit easier when this thing first happened with regard to parents' participation in the process, because an awful lot of moms and dads were home. In the fall, fewer of them may be at home and maybe at work. I imagine you had to think about that consideration as well.
Absolutely. So we know that it's a burden, and you're right. Right now, everybody's home, so there's more opportunity and supervision and support, and that may not necessarily be the case in the fall. And we know moms and dads need to go back to work. So we have worked with our community education and early childhood directors to create a child care plan for our kindergartners through 8th graders so that they can return to the building on the days they're not in school. We will have the opportunity to provide childcare from 6:30 in the morning until 6:30 in the evening for those families who need childcare. We don't want this to be something where it devastates a family and a parent has to make a choice about whether returning to work or not. So we worked to develop this a flexible plan that we will be responsive to the needs to our families, and certainly most importantly, that it is financially doable for them. We know that we have families that have been impacted by the closure and that may not have work or may not have the same level of pay that they had prior to. So our goal is to make our childcare affordable for our families. Our free and reduced lunch families will have minimal, if any, cost, and will be on a sliding scale from there. It is the goal of the district is not to certainly make money on childcare, is to provide a service. And so we just need to be able to cover our costs and offer it to our families as well.
Deanna Barash, Assistant Superintendent for Curriculum and Instruction, West Bloomfield School District. Since this announcement, have you heard from other schools? And I know the superintendents, and I'm sure your colleagues as well, are all talking to each other and sharing notes. What are you hearing from our other districts in the area?
I think as we were in the spring, and we were the first ones to announce our plan, I think that many districts are in the same place we are. We're beginning to think about it. We wanted to be the ones who wanted to get out in front and really to provide some peace of mind for our families and for our staff. I think everyone is in a little bit of a planning but wait and see mode. We've had lots of calls, we've had lots of questions. My team, who are involved in a variety of task force across the county and then regionally and actually across the state, have been contacted. What are we going to do? Can you share your plan? What are some of the logistic things that are going? And we're always happy to share. It obviously makes sense that it's more groups working together and more continuity among the county or even among the state is going to make these plans work better. So we're happy to share that information.
All right. Well, Deanna, thank you very much for being with us. I really, really appreciate it today. Good luck. And I just want to invite people, if they want more information, a lot of information was shared with the local community during Monday night's school board meeting. And if you're listening to the Megacast and you're in another community and you want to go back, I mean, if you're a meeting geek like I am and Tyler over here, that's what we do. We cover local meetings. But if you want to go back and watch a school board meeting, it was really very informative and interesting, and a lot of interesting dialogue and discussion, and that is up on our website at civiccentertv.com. So some other information there. And Deanna, let's keep in touch, all right? Let us know how this all goes. And, of course, everything is subject to change with the swipe of the pen from the governor and others. So we'll keep an eye on it.
Thank you for having us.
Hey, no problem. Say hello to everybody at the West Bloomfield School District. Thank you for being with us. Megacast right here on Lakes FM, the Biff 89.5, Avondale Community Radio, Civic Center TV, Birmingham Area Municipal Access Television, both Channel 15 in the various communities, and Comcast, and of course Channel 99 and AT&T. And a big thanks to the West Bloomfield School District. If you want to watch us on Facebook today, you just go to their Facebook page and check in there. So we appreciate all that going on. Tyler, let's take a 30-second break. We'll be back. This is the Megacast.
Is deadly, but Michigan can fight back. Our front doors are the front lines of defense. Staying home is the best way to stop the spread, because just one infected person can give it to 40, who can give it to countless more. So call Grandma, don't visit. Video chat, don't meet up. And if you must go out for food or medicine, keep at least 6 feet from others. Stay home, stay safe, stop the spread.
Welcome back. Thank you for tuning in. This is the Megacast. What's a Megacast? Tyler, what is a Megacast after all?
It's not just your regular broadcast or simulcast or podcast. It's a little bit of everything clumped together with a combination of multiple community outlets throughout Oakland County.
Ladies and gentlemen, Tyler Webster Dictionary Encyclopedia Dude Keefe over there.
Am I not?
Well done. This is the Megacast on 89.3 Lakes FM, 88.1 WBFH The Biff, WAHS 89.5 Avondale Community Radio in northern Oakland County and a bunch of Macomb County. Thanks for watching us on our municipal television stations. And in addition today, also watching on the West Bloomfield School District Facebook page, which is one of our favorite Facebook pages to be on, only second to the Oakland University Facebook page, because every time we're on that one, 10, 20,000 people are watching, so big audience there. Speaking of Oakland University, we are delighted to be joined now by one of the fine folks from Oakland University. It's Jason Wasserman. He is an associate professor of bioethics at Oakland University. That's a pretty big business card as well, Jason. Thank you, and good to have you here on the Megacast.
Thanks. Bioethicists have been busy lately, as you know.
Well, yeah, absolutely. So you are a professor at the Oakland University William Beaumont School of Medicine. I see your William Beaumont School of Medicine pin. Flying the flag today. Just as a starting point, as a foundation, we get it, but just definitionally, tell us about bioethics.
Yeah, so bioethics broadly deals with the moral dilemmas that come up as a result of issues of life and death. So broadly speaking, it can include all sorts of things like the environment and animal rights, but I'm mostly squarely in the clinical bioethics space. So we really deal with specifically the ethical issues that come up in the context of healthcare and specifically patient care.
So it must be a busy time right now. As it relates to the coronavirus, what has been crossing your desk?
Well, I think we've gone through some waves. So the first one was, as we saw cases starting to surge, how are we going to make fair decisions about who gets resources if those resources become scarce? Of course, everyone wanted to avoid scarcity. We never wanted to run out of ventilators, and we thankfully haven't, although if we see a second surge, that's still a possibility. But we had to plan for the case in which we might. And when you have one ventilator and 2 patients who need it, it's a very challenging ethical issue to decide who you should give it to. It's a decision that no one takes lightly. As we talked about how to plan for that, I think the moral weight of it was on everyone's mind. But it's a situation of a forced choice, and you have to make a decision. And then the question becomes, how are you going to make that fairly? What are the criteria you're going to use to make a fair decision, and what criteria should be off the table because they're unfair? That was the first kind of set of issues that we dealt with, and then we moved a little bit more into issues of moral distress among the staff as they were becoming overwhelmed at the hospitals, as we experienced PPE shortages and those types of issues. Those are ethical issues as well, how we treat our healthcare workers. And I think more recently we're moving into more questions about how we distribute these new medicines and how we inform people who might be taking them about them, given that they're new and data about them may be a little bit sparse. So remdesivir, for example, is in relatively short supply, but hospitals are starting to get it. They don't have enough for every patient. How do they decide who gets those medicines? And then how do they tell the patients about the potential side effects of that medication when there frankly just isn't a whole ton of data behind them yet?
Yeah, well, that's a boatload that you just dropped on us. Dr. Jason Wasserman, Associate Professor of Bioethics at Oakland University. And you're right. So we got through the initial resource crunch with the vents and the PPEs and the other things. But we have a big resource crunch ahead of us. You talked about the therapeutics that are out there. There clearly are not enough for everybody. Big challenge. And then here's the next one, vaccine. So we are racing to a vaccine. And we hope that we get a vaccine developed, but getting it developed and then getting it manufactured and distributed to the world, that is a whole other story. We're going to have folks like you that we're really going to count on for advice. You know, if you are a little bit cynical and you look at our history, I think you would say that the wealthy and powerful will probably be at the front of the line.
Yeah, I mean, the policies we put into place are supposed to protect against that, right? So we talk about, for example, legitimate versus illegitimate differences. And typically speaking, for healthcare issues that are healthcare resources that are matters of life and death, ability to pay should never be a determining factor in who gets a treatment. But of course, you know, the realities of the American healthcare landscape certainly find wealthier people able to access more care in all sorts of different ways. I would hope to see policies developed that mitigate that to whatever extent is possible when it comes to something as basic as a vaccine is essential to public health, particularly because many of the essential workers on the front lines are not among those wealthier brackets. And they may, I think, have maybe a stronger claim from a public health standpoint. But as you point out, inequality is a rather permanent feature of American society, and I wouldn't be surprised to see it leak its way into those decisions.
Well, we hope not, but I think we've done a pretty good job actually making sure that first responders and those on the front line are getting access to things first. You know, we all get a little frustrated when we go to the grocery store, and less now than maybe a month or 2 months ago, and you see someone wearing an N95 mask, and you just think, well, are they really a doctor or a nurse? You know, or is somebody putting their own priorities ahead of the medical community? We really hope that doesn't happen, and I would say by and large people have done a really good job. But, you know, you, Dr. Wasserman, and others all take this Hippocratic oath to make sure that we are serving people in the best interest. And you know, you guys do a great job, but there's a lot of ethics involved and the political side, and you know, we don't have enough hours in the day to talk through that one. But it's good that you're watching that. Is this, you have a program then at Oakland University where students are engaged in this whole process?
Yeah, absolutely. And just to clarify, I'm a PhD, so I've actually never sworn to the Hippocratic Oath because.
All right.
But I will tell you, at our program at Oakland University, I direct the bioethics thread of our curriculum for medical students, and as part of that curriculum, our medical students actually write their own oath that they swear to at their graduation, along with all of the people in attendance, many of whom are physicians, which is amazing to see because what they're able to do is carry forward those hallowed ethical commitments that you just mentioned, providing the best patient care possible, putting patients first. But they're also sensitive to how the landscape of healthcare has changed since those oaths were really formulated. Even though they've been updated recently, the foundations of many of those oaths, like the Oath of Geneva, really date to just after World War II. And my students are always amaze me when they come up with these new and interesting things that they're concerned about. One of which, for example, is interprofessional teamwork. They have written into their oath over the last few years commitments to treating other members of the healthcare team, like nurses and respiratory therapists, with dignity and respect and collaboration, which is not something in the oath. So I have working with these students every day gives me a lot of faith in our future.
Well, always. When we work with young people, I would say the same thing. The young people now that we have the pleasure of working around amaze me every day. But I like what you're doing. I think it's fantastic. And, you know, we always learn something that we didn't expect to learn on this show. Today, it's that oath. I mean, the oath that we just stumbled upon talking about that your students are taking. It got me thinking, maybe, you know, we as a society should go back to a little bit of JFK, ask not what your country could do for you, but what you could do for your country. Maybe it's time that we as individuals all take the oath, whether we have raised our right hand and put something down on paper. I would suggest, Dr. Wasserman, and I'd like your feedback, that people have done pretty good. We've done pretty good. We got things flattened out. There's a couple of idiots out there that are misbehaving, but, for the most part, when I go to the store, I see people wearing masks. I see people social distancing. I think, for the most part, people have taken the oath. Your thoughts?
Yeah, I agree with you. I think a lot of times what we latch onto in our society are the margins and not the massive center. So we kind of we want to hear on the news about the extremes. We have this kind of predilection for those kinds of stories, but I think the average person takes the pandemic quite seriously. I do think it's challenging for any of us to really comprehend it and to comprehend what to do, because the data does change, and that's just the nature of an emerging infection. But it does challenge us in terms of clarity about what we should do. But I think people are by and large doing their best.
Jason Wasserman is with us, Associate Professor of Bioethics at Oakland University. And Dr. Wasserman, one of the things that we've been talking about for several weeks right in your toolkit is what's going on with the African-American communities. We have seen just a huge impact on COVID-19 on our communities of race here in Metro Detroit, and maybe that's one of the reasons our numbers have been higher than the rest of the country. Any thoughts on where we're at, what we need to work on in that area?
Yeah, well, the emerging data is pretty striking. So as of May 15th in Michigan, where there's we have a 14.1% Black or African American population, that group is experiencing 32% of the overall cases and 40% of the deaths. There's a lot of social factors involved in that. Residential segregation that has persisted long after the 1960s and 70s in effect. Is one reason for it. Residential density is not equally experienced by all groups, and some of that owes to race and ethnic segregation in the residential sector. But then there's also lack of healthcare access, lack of access to physical activity opportunities or healthy foods. These things are also distributed unequally and therefore disproportionately affect certain race ethnic groups in our society. And those predispose people to the kinds of comorbidities that really complicate COVID. So for example, hypertension, obesity, and diabetes are three very significant comorbidities that complicate and make one more susceptible to COVID and the effects of it, make one more likely to suffer an acute version of the disease. And these comorbidities are higher among the African American population for reasons that have to do with structural inequalities in our society.
Well, it may be, if any good has come out of this, the greater awareness of those problems in our communities here in the African American and other minority communities. It has raised the awareness. It tragically has raised the awareness, and maybe we can, at some point, start working on that. We have an awful lot to work on right now, but we'll add that one to the list. Thank you for being with us. I appreciate this. Did you want to add something?
Oh, well, yeah, I just, in keeping with your point, one of my biggest worries and maybe one of my biggest hopes is that after COVID, we don't forget about these types of disparities, because these are not disparities of COVID. They're disparities of almost all illnesses, and they'll be with us long after, hopefully, we surpassed the COVID crisis.
Well,
Thank you very much.
No, it's good to have you on here. I didn't really think about that before this came up. To tell you the truth, Dr. Wasserman, I don't really think I thought much about bioethics very often. So you're in the limelight. We appreciate you coming on. You make Oakland University proud. Thank you very much for being here. I appreciate your time today.
It's been a pleasure. Thank you so much for having me.
All right, and we'll have you back again. He is Dr. Jason Wasserman, Associate Professor of Bioethics at Oakland University. And Dr. Wasserman, if you wouldn't mind, we have our COVID-19 vocabulary, and we put interesting things that come up on this show. I'm going to add, we like COVID foot, facial covering displacement. That's when your mask is not on your face. Non-dominant hand came out of another interview. As you know, you're trying to be careful which hand you're using. I'm going to add the COVID-19 oath today, and maybe we can get some people thinking about taking an oath and doing all they can, inspired by you. Thank you very much, sir.
Appreciate it. Thanks for having me.
All right. We add that to the list. Tyler, COVID-19 oath. What do you think?
I think that's a great one to add.
All right. We are going to take a break. We'll be back in a couple of moments. When we come back, I believe that Erica Jones is standing by at the Oakland County Farmers Market. We're going to see how things are going on out there. It's a beautiful day, and they have an amazing outdoor market. We'll find out what's going on there and get her update. And then we are also, before the program is over, going to check in with John McNamara, Vice President, Government Affairs, Michigan Restaurant and Lodging Association. They are right in the epicenter of all that is going on with COVID-19 and the new announcements today. We'll be back in a moment.
Technology like smartphones are wonderful devices to reduce social isolation in older adults. You can call grandchildren, phone friends, participate in fitness classes, and play games. But you need to stay mindful of scams. Scams related to the COVID-19 virus are rising. These include attempts to obtain personal information from seniors, including pitching unreliable products, advice, tests, and cures. You need to stay vigilant and be cautious. If you feel that you have been taken advantage of, it's okay for you to reach out to somebody you know and seek out advice, or even contact your medical provider. Thank you.
No American has ever needed a haircut more than the host of the Megacast right now. Tyler, you're looking pretty good over there. Let's get you on camera.
It's the first time for everything.
You're looking okay. I mean, your hair always looks like that. You got that millennial haircut going on over there. Just kind of like, No?
No, I would much prefer my hair to be cut.
little tighter than that?
Oh, yes.
All right. Did you find out if the salons are going to open? I don't think they are,
have
in the midst of today's announcements.
I've been researching it, and I haven't seen anything about it.
All right, welcome back. It is the Megacast, 89.3 Lakes FM, 88.1 WBFH, The Biff. Thanks, Ron Woodable, for making it all happen there. Logan out at Avondale High School getting us on and off the air every day. And 89.5 Avondale Community Radio, WAHS. Thank you very much. We're on Community Television, Channel 15, and Comcast in many of our communities. You'll find us on Channel 99 on AT&T, everywhere else, and online at CivicCenterTV.com, and of course today in the West Bloomfield School District Facebook page. We invite you to check us out at one of those many locations. All right, so about a week ago or so, we had the folks from the Oakland County Farmers Market, and they've really expanded things and have a great operation going on there. And it's really, Tyler, I wasn't thinking about it, but it's always fun to go to the farmers market on Saturday. But they have it expanded to many other hours. And they're outside. What a great safe way to shop. Let's check in now with our own Erica Jones out at the Oakland County Farmers Market. Hi, Erica.
Hi, I'm here at the Oakland County Farmers Market, like you just said. It's a gorgeous day. So many people are here. I've been here for a while now, so actually less people are here now. I got here this morning, and you couldn't even find a parking space. You can see it's lots of people. Pretty much everyone has on a mask, so that's good. Lots of flower.
Eric, I could see the people are doing a pretty good job social distancing.
Yeah.
And you seem to be doing a really good job social distancing. You're staying away from everybody over there.
Yeah, I talked to a couple guys working at the barbecue tent right here that said they would do an interview in a moment. So I'm just standing over here. Isn't
it the way that always goes? You're all ready for your interview and your stand-up, and then the studio comes to you and your guest isn't right there. It just kind of works out that way.
Yeah.
Right? So are they there, or are you waiting for them still?
Here, just say hi.
You got some fans out there, huh?
Yes, here at the farmers market, working hard. Are you guys having a good day? Good. How are sales going? Are you happy to be back up? Okay, yeah. Sounds good. You will on Saturday? Okay. I don't want to impose too much since you guys said you didn't want to do an interview, but I'm glad that everything's all right. Good to. Oh, thank you so much.
All right, that was good. You know, listen, you got to get the story, Erica. I know that the interviewees are not always, eager, but you did a good job getting them. What?
Yeah.
So
they
that's
told
just,
me they didn't want to do an interview, so I tried to not get.
No, I get it. So tell us what kind of activity, what kind of booths are there, what kind of items are there. Just kind of paint the picture, if you will,
Yeah.
as you show us what's going on as well.
So the nice ladies we just talked to are selling honey, and then we have the barbecue tent right here behind me. And then over here, this way, is all the flowers and everything. So that's pretty much what takes up most of the market. I walked away from the barbecue just because he told me a few minutes a while ago, and they seem pretty busy. So I don't want to. I think we should get some other. I think I should show you guys some other stuff instead of standing around there.
While you're moving from spot to spot, I just want to let everybody know it's Erica Jones from Civic Center TV and Lakes FM. She is out at the Oakland County Farmers Market, and Tyler, that is up right near the Oakland County governmental complex, right?
Yes.
All right. Do you have the address or anything?
I can pull it up right
Tyler will
away.
get that.
It's 2350 Pontiac Lake Road.
There you go, 2350 Pontiac Lake Road. Okay, Tyler and Erica, so we're back on your camera now. Erica, tell us what we're seeing.
So this is all the flowers. That's what's taking up the majority of the market outside here, if you can see. I actually have not gone inside yet, so let's do that right now.
All right, let's see how that
I don't know
goes.
how often you're.
By the way,
If
when
I
you go on Saturday, you're going to see a lot more of the food vendors. Saturday morning is their big time. So if you've not gone out to the Oakland County Farmers Market before, as you can see, it's really cool. Okay, Erica, we're inside with you. What are we seeing inside?
I'm not exactly sure. Hi. What are you working on? Oh, these are beautiful. Can I?
All right, so we're going to let Erica talk to the folks out there, but bottom line, you can see some of the activities going on, and not quite as busy today, Tyler, as it would be on Saturday, but they're open on Saturday morning, they're open on Sunday morning, and we would invite people to go out, and we thought you would just enjoy a little glimpse of what's going on, a lot more space here. It's not midweek Thursday, not one of the bigger days, because people are at work and doing their own thing. But come Saturday, it's going to be jammed. Although people will be keeping their social distancing, it's going to be a great lot going on, and we advise people to get out there and check it out. Erica, we're going to wrap it up. Thank you for being with us.
Yeah, of course.
Would you get some barbecue and bring some barbecue back to the studio for the guys? I'll pay you back if you grab some barbecue for us. All right.
What do you want specifically?
I'll let you and Tyler work that out. Okay. Anything you bring back, we'll eat.
What?
All right.
Whatever you'd like.
Okay, sounds good.
All right, there she is, Erica Jones, live in the streets of Oakland County at the Oakland County Farmers Market. Little informal, Tyler, but that's just the way we roll. She'll continue to get out there and get in the public. When you're live in the streets, you never know exactly what's really going to happen, right?
You do not. No.
You do not.
It's always a mystery.
We are going to take a break. In a minute, we'll be back. We'll check the top headlines of the day. There's been so much going on. Governor at a press conference earlier today. We'll recap what happened. More of the state is opening up. Certainly talk about the unemployment numbers that came out yesterday and the crisis up in Midland. And our hearts are with all the people up there having a really hard time. But good news. Looks like the governor and the president will be working together on that. And we're going to check in just a moment. John McNamara will check in. He's the vice president of government affairs of the Michigan Restaurant and Lodging Association. That when we come back.
Hi, I'm Oakland County Executive Dave Coulter. Our top priority remains slowing the spread of COVID-19 in our communities. Please stay home, and when you must go out to an essential business, take precautions like social distancing and washing your hands when you come home. Because of the pandemic, we are behind in our response rate in Michigan. While you are home, please take a few minutes to fill out the census. It is more important than ever that we receive money back from our federal government. The census is Oakland Together.
Wow. What a busy day today has been. Thank you for joining us on the Megacast across Oakland County. Dave Scott, Tyler Keith in our Lakes FM studios. Megacast is on great radio stations, community television outlets, and all over the internet. CivicCenterTV.com is the simple place online to watch us. We also, each and every day, have a Facebook partner. Today it's the West Bloomfield School District, and we get thousands and thousands of people every day watching on Facebook, so thanks. Thanks to our great radio stations, 89.3 Lakes FM, 88.1 WBFH, and 89.5 Avondale Community Radio, all right here in Oakland County. He is John McNamara, the Vice President of Government Affairs of the Michgan Restaurant Association. Checking him via Zoom. Mr. McNamara, thank you for joining us here again today on the Megacast.
Absolutely. Thank you for having me.
They gave me the day off last time you were here. We didn't get a chance to meet, so I'm glad to get a chance to chat with you today.
Sure.
Thank you very much for being here.
Absolutely.
So, pretty big day. Governor announced a press conference right at the beginning of our show. And to quickly recap for folks, I know you saw it, so correct me if I'm wrong. We are opening up dental offices and optometrist offices and veterinary offices. Those are going to be opening on May 29th. We are going to be opening up auto showrooms in a couple of days as well. 10 people or less by appointment. Retail is opening. 10 people or less by appointment retail. It's a little bit better than curbside. Mr. McNamara, I do not see restaurants on this list, but I imagine that was not a big surprise for you today.
It was not a big surprise at all. We obviously had some heads up from the governor's office. The press conference was coming, and that we were not going to be a part of it. And we, first of all, want to thank Governor Whitmer for opening up Region 6 and 8 before a busy Memorial Day weekend. We obviously had some heads up on that as well. So it's been a great working relationship working with her and her staff. And, we're looking forward to continuing to open up restaurants responsibly as we can.
So, Dave Lorenz of Travel Michigan, I assume. I had him on a couple of minutes ago, and I said, Dave, I'm going up north this weekend, and I'm going to report. In fact, I'm leaving later on today to report on how things go this weekend, and I want to see firsthand what's going on. Dave, you can't go up north. But, listen, I have a place up there, and I'm going to be reporting. It's going to be all work. I just want to assure you and everyone listening, when I go to a bar at midnight tonight with my camera, there'll be no consumption whatsoever, because that would be crossing the line. But it is going to be, in all seriousness, it is going to be interesting to see how this weekend goes, and I'm sure I'm not the only one who's going to be watching.
It's going to be interesting, and I would get on my knees and beg if it wouldn't take me out of the camera shot, but it's going to be critically important that everyone who goes, be patient, be understanding, and give staff and restaurants time to adjust to this new normal. No one's ever done this before. And if this goes well, then hopefully we can start to reopen other regions in the state, and everyone can start to dine out again. But as the governor said, if it does not go well, she will be watching, and then she'll take that into consideration when opening up other regions in the rest of the state. So a lot is riding on Northern Michigan and the UP this weekend in doing this well and doing it responsibly.
Well, and that's why I want to go, because it's just like this show. You see CNN, you see what's going on in Fox News, you see the Michigan TV stations and the big media. They do the best they can, but they don't always get the entire story. And when you get really local and you go look for yourself, sometimes you find things that are different than maybe what has been reported by one reporter who characterizes what's going on everywhere. And I'm not going to spin the story, but I am going out and I'm going to look to get the real deal. And based on what I've seen going to my grocery store, and based on what I've seen going to my retail establishments, and based on what I've seen going to the other places that have been open, people in Michigan have been doing an unbelievably good job following the rules.
Yeah, they have. I think most recently I saw a grade of B+ or A-, depending on the region, of everyone sort of following the rules and doing their part to get this over with as quickly as possible. Obviously, no one's happy about it. Nobody saw this coming. But, as Michiganders tend to do, we rally and adapt quickly, and we all want to see this over and be able to as much of summer as we can out in Pure, Michigan.
John McNamara is with us. He is the Vice President, Government Affairs, Michigan Restaurant and Lodging Association. John, what kind of things are you advising to those that will be opening this weekend in northern Michigan?
So obviously, outdoor dining, even though it's outdoor, the tables still need to be 6 feet apart. Anytime, in between guests, wipe down tables, wipe down chairs. Inside, the same thing. Everything 6 feet apart. Constant sanitizing, things like doorknobs and handles and things like that, wiping that down. A lot of people are going to be using single-use menus so that, once one guest touches a menu, they're going to recycle that piece of paper, but another guest is not going to touch it. So we're even seeing some guests put table tents on the tables with a QR code so people can pull out their smartphone and see the menu that way. So, items like that, we're going to see a limited menu. Obviously, there's going to be some supply chain issues. They have not been able to get deliveries. So you're going to see a limited menu. But anything they can do to keep people 6 feet apart and, sanitize as much as possible. Signs everywhere educating patrons on the proper way to sort of handle this new normal. But, we put together about a 29-page document called our Roadmap to Reopening a few weeks ago, and that's been in the hands of our members and really anyone who went to our website to download it. So they've had a lot of time to sit there and generate and figure out how they can do this. Unfortunately, they're going to have to sort of, do it live for back of the letter term this weekend and see how it goes.
Well, you've talked to your members, and you guys do a great job. And I know your members, they only want the best. They want to be able to open. They want
Absolutely.
to be able to continue to stay open. And we don't want to screw this up this weekend and the next week or two up in northern Michigan because, that everyone's watching and there'll be a grade given out and it will impact, whether we like it or not, it's going to impact what happens around the rest of the state. So it's a partnership, though. And, John, that's why I'm glad to talk to you today because all the restaurants can do everything they're supposed to do, but we have to do what we're supposed to do. So I just want to double check. So we probably should wear our mask into the restaurant and then take it off when we're eating. Is that what we should be doing?
Take it off when you're eating, and even once you're seated at a table with whoever you arrived with, you can take it off. And I would encourage everyone, if you're meeting friends, that's okay, but do your best to arrive together. Even if you can drive together, that helps as well. But really, once you're seated at the restaurant, you can take that mask off. Your server is going to have a mask on likely the entire time, except when she's taking your order or if you ask her a question about something, then he or she will take it off at that point and do that. But you're going to see a lot of staff with masks on the entire time.
Yeah, and I like what you said about using technology. Why not? Why use a menu when you could do it digitally on your smartphone and the QR code on the table tent? That's a really good idea. So we'll see all that going on. And I just want to remind people, too, we're not supposed to be getting in our cars and driving anywhere. The stay-at-home order is still in effect, and this is an Oakland County show. And people in Oakland County, if you have a place up north, it's okay to go up there and do the work that you have to do to get it ready. And, of course, if you are, you're going to go out and have a bite, maybe have a beer. But we're not. The campgrounds aren't open. Northern Michigan is really. If you don't have a need and a reason to go up there, you're not supposed to be going up. I assume.
That's correct.
Is that your read on it, or is that what you're seeing?
Right. So yeah, it's clear in the executive order that campgrounds are closed. But if you're going to and from a residence, that's completely allowed. And obviously, if you're up there, you need to eat something. So we would encourage you to go out. We would encourage you to just do it responsibly. And again, just have patience with staff, have patience with everyone there. And if you're seeing something that you don't like or you don't think is correct, I would just ask them either why they're doing that or ask them to do it that way. I would encourage you not then just to go on Facebook and trash whatever establishment it is or call the health department or something like that. just give everyone a little bit of patience there. And, obviously we're in the service industry. We want to make our guests as comfortable as possible. And I think if you ask someone nicely to do it, they'll be happy to do it for you.
Yeah, and if you don't feel comfortable, don't go. But I think
Sure.
there are plenty of people. I don't know. I think a lot of people are excited about this, and I think it's going to go absolutely great. And we only want the best for the restaurants. A lot of us have been doing what we can to support the restaurants and their current carry-out status. And You know, I just want you to know, John McNamara, the restaurants in my area in Oakland County, they've been so creative and inventive with setting up their safe carry-out procedures, and they all do it in a slightly different way. They got maybe a plexiglass barrier, and a lot of the drive-thrus have done a really good job with that. We've seen a lot of creativity, and it's been a lot of extra work for people to be able to comply, but they're out there doing it each and every day. So congratulations to you and to your members.
Yeah, well, I mean, that credit all goes to our members for, essentially reinventing their business model overnight so they can continue to feed people. As I mentioned before, 51% of the meals in this country are provided by a restaurant. So if restaurateurs across the state were not finding ways to do this, then there wouldn't be food on the shelves at grocery stores. So all the credit goes to them for what they've done so far.
Can the restaurants make money doing, I hope you don't mind me asking, can they make money this way?
Most of them cannot. I mean, they can maybe enough to get by, but for the vast majority of them, they are either operating at a slight loss or maybe making a little bit of money. But for most of them, this is just a way to, keep some employees there and then feed the community as well. But I mean, we're seeing, people whose numbers are down as high as 70 to 80% during this time.
And are the communities cooperating? Because I think right now, if the weather is going to be nice this weekend and we're coming into the summer, why not move tables outside? It only makes sense, opens up a little more space. Is that working, or do the restaurants, are they running into challenges and problems with the municipalities in northern Michigan, allowing them that space, or don't we know yet?
Nope. We started working on that about 10 days ago. We sort of took a model from the city of Tampa, Florida, where they started doing that. And the governor's office and the Michigan Liquor Control Commission, as well as local municipalities, have been incredibly helpful in basically saying, we'll work with you in order, as long as you guys are doing this responsibly and you're acting in what you think is best. They've been great to work with. So you're going to see some tables in parking lots. You're going to see some tables maybe, onto some, if it's next to a public park, into some public space. So you're still going to see some creative solutions up there this weekend. And when we continue to open, you're going to see those solutions across the state. But that's a cheers really to, again, the legislature, the governor's office, the Liquor Control Commission, realizing how important this industry is and giving us the flexibility to operate in this unprecedented new normal.
I don't know if you want to dare a guess. Do you have any idea when we may see all this in Oakland County?
I think that really depends how it goes this weekend. I think if it goes well this weekend, then I think you could see mid to late June some patio seating in Metro Detroit, and you could see some reduced capacity indoors. But if it doesn't go well this weekend, she's made it very clear that Governor Whitmer said, this is a test, and I'm gonna look at this. So, we're gonna have to see how it goes this weekend. We're gonna have to watch the cases continue to decline, but we're hopeful here sooner than later that Oakland County and the rest of the state is going to be open in a different and limited capacity, but open in some way.
All right, John. Well, I'll have all my video. If you want any of my video for Northern Michigan, I'll have it for you. And I expect we're going to see a very good result. We'll talk to some people and report down here because people down here want to know what's going on with all this too. So for a necessity, I need to get up to my place this weekend. So we might as well find out what's going on, right?
Absolutely.
All right. John, thank you. Really good to meet you. I look forward to doing this in person. I cannot wait till you and I could sit down, break bread, have a beer at one of your restaurants here in Oakland County, okay? So can we just put that on our calendar and we'll do it as soon as we can?
We absolutely can.
All right, very good. He is John McNamara, Vice President of Government Affairs, Michigan Restaurant and Lodging Association. Greatly appreciate him taking time for our little broadcast today. Dave Scott, Tyler Keefe right here in the studios. Tyler, we only have a couple of minutes left. Really quickly, let's just go down the news from the day. First of all, again, Midland flooding, terrible. President has not signed a declaration of an emergency. Governor has asked him to do it. He's in Michigan today at that Ford plant, as we know. President and the governor did talk on the phone, though, and they have had a very good conversation. That's good, because those two don't get along very well, now do they? So we will hope to see that that something comes of that. And the governor and the president said, they each said that they would go there together if, in fact, that happens. So good news, good cooperation. We like to see that. Unemployment numbers for the state of Michigan, April, 22.7%. That is a huge number, Tyler.
It is, and it continues to grow, and the situation continues to change. Hopefully, the Unemployment Insurance Agency in Michigan has improved their operations, and we can get these people that are going on unemployment effectively through the system and get them their unemployment checks as soon as possible as this continues to go on, because our economy is still mostly shut down, and as that continues to happen, we'll continue to probably see some more layoffs until we start to see things open up.
And, of course, Northern Michigan, the UP, less than 1% positive COVID tests, about 2% positive in the tip of the mitt. They're opening up this weekend. We talked about it, restaurants, some offices, and bars. Midnight tonight, I'll be there. Can I just report on my cell phone? Do I have to take a real camera with me?
I think a cell phone's fine.
Okay, I will be reporting on the cell phone. I'll get video, and we'll have it here on the show on Tuesday. We're not here on Monday, so we'll report back here on Tuesday and see how things go up there. Back closer to home, dental offices, optometrists, veterinary services. Those doctors' offices that have been closed are going to open up on May 29th. Auto showrooms, finally, they're going to open up. I mean, I assume that would be in boat showrooms as well, Tyler. They didn't say it specifically. By appointment, and only 10 people. And for goodness sakes, retail is finally going to open, and that is great. And 10 people or less in your retail establishment, you have to make an appointment. Here's the thing, it's going to affect more people listening right now than ever. You can finally go see somebody. If I'm interpreting this right, gatherings of 10 people or less are now allowed. We still have the stay-at-home order, and it's a little bit in contradiction to the stay-at-home order, because if you can gather for 10, you've got to leave home to do that, unless, I guess, you're inviting people over to your house. But you can now, I mean, really, under the stay-at-home order, you couldn't go hang out. I couldn't come over to your house.
No.
Right. But now, I know you don't have any more than 10 friends, and I certainly don't. So we would have no problem having a little gathering, now would we?
No.
All right.
No problem there.
Okay, so I think you can do that. You're not going to get arrested if you screw up a little bit, but that's basically, and that has been implemented effective immediately. 10 people or less gatherings. Be cool. Keep space. Do the right thing, but you can do that now. So that's big news. The governor, the other really big story, Tyler, the governor said she is going to extend the stay-at-home order, and that just kind of slipped in at the end of the conversation with everything else. I don't think that's that. I mean, I guess you got to do that. She's keeping the order in, but she's expanding it to 10 people or less. So, how that all gets interpreted in the coming days and reported and explained by the Attorney General's office, we'll know.
Well, we'll see what happens with it. I think it's something that should have been expected, but saying that before the announcement is formally made, who knows what kind of reaction it gets.
Governor, I thought, was really good today in her press conference. She talked about this weekend. She said, look, a lot of things are opened. It's Memorial Weekend. Get out on a boat. Go fishing. She said you could water balloon in the backyard and have a beer. So why not go out and have fun? I also thought, just interesting, as a political observer, forgive me for being a little bit cliche here, but I thought it was interesting, and believe me, our hearts are with all the people in Midland where they had that terrible dam disaster up there, right? And so I was waiting for the governor. Can we call it that, the dam disaster?
It's technically correct.
All right. I mean, so I was waiting for her, and she almost said it. She did say, fix the damn roads, and then in the next sentence, she almost said, fix the damn dam. But we'll have to do some creative editing to get that quote. But listen, she was in all seriousness, very critical of the dam operator. It's a private dam. She made it very clear that the flooding up there is a result of a failure of a private dam, and that organization that owned that dam had been violating a bunch of rules, and they're very concerned about that. And she's very concerned as to whether or not we should leave critical infrastructure like that in the hands of private individuals. One Matty Maroon might have something to say about that, the guy who owns a bridge downtown, right? But there you go. So we just pass along the information. Couple of minutes, really quick run through of the COVID-19 vocabulary. Tyler Key, Flatten the Curve.
Flatten the Curve is a concerted effort by the community to reduce the chances of an exponential spread of coronavirus.
Physical distancing.
Keeping a safe distance from other people to lessen the chances of you picking up the virus or spreading it to
And we
them.
do this, by the way, to make sure sure that you understand these are things that you want to be careful about and continue to observe. And we remind them with our we remind you with our COVID-19 vocabulary. What's the happy birthday song?
That is the song you should sing twice over. Get at least 20 seconds, but even more while you're washing your hands.
Asymptomatic.
If you're asymptomatic, you may have COVID-19 or another virus, but not be showing physical symptoms.
PPE.
Personal protective equipment. That's your face masks. That's gloves, face shields, and so on.
Okay, here are the new ones. Contact tracing.
Contact tracing is formulating a group of contacts from people who may have been infected or been around someone infected by COVID-19, so you can track where it may be going.
Your non-dominant hand.
That's the opposite hand from what you do most activities with. So if you throw a ball right-handed, you want to open doors with your left hand so you have less of a chance of scratching your face with your dominant hand and giving yourself coronavirus.
If I had my face mask on, I could show you facial covering displacement.
That is aligning your face mask in a way that does not prevent COVID-19 from being picked up or being transmitted.
And finally today, brand new and added as a result of one of our interviews today, the COVID-19 oath.
Well, that is an ethical oath being taken by the members of the population as well as medical officials to do as much as they can for the common good as we
I
combat
do solemnly
coronavirus.
swear I will wear my mask. I will keep my 6 feet of distance. I will do everything I can
Are we
to
raising
behave.
our dominant
And I will listen next week, beginning on Tuesday, not Monday, to the entire Megacast. That is my COVID-19 oath. Have a great Memorial weekend. Tyler will be here tomorrow. I'm out of here. Have a nice weekend. We will not see you on Tuesday, and we will be back Monday, and we will be back on Tuesday. Have a great week.